Okay, let's begin now with our last section, in which we will talk about the granulomatous diseases of unspecified etiology that can affect the nose. In this, we will talk about Wegener's granulomatosis, T-cell lymphoma, and also sarcoidosis. Wegener's granulomatosis is the etiology or the cause of Wegener's granulomatosis is unknown. That's why it comes under the unspecified causes of granulomatous disease of the nose. It affects the upper airways, lungs, kidneys, and skin. All these structures are affected by the Wegener's granulomatosis. So it's systemic disease, it's multi-system disease because it affects other organs of the body also besides the nose. It affects the kidneys and also the skin. Treatment is different from non-healing midline granulomas. So Wegener's granulomatosis is treated differently. It's multi-system disease. This involvement of different systems is extensive in Wegener's granulomatosis, but the cause or etiology is unknown. The clinical features of Wegener's granulomatosis is early symptoms. How it presents is mainly there is nasal discharge, persistent cold or sinus problems. Also, there is crusting, granulations, perforation, and saddle nose deformity, and destruction of eye, palate, ear, etc. So early symptoms of Wegener's granulomatosis, it causes the nasal symptoms. There is discharge and deformity of the nose also occur, in which there is saddle nose. The nose is, bridge of the nose is depressed or compressed downward. That can be corrected surgically. Also, there is perforation of the septum and crusting and granulations formation. All these can cause nasal obstructions, problems that can cause obstruction, and these granulations should be removed. And then as the disease progresses in the early stage, it can also cause destruction of the eyes, palate, and all. It can spread to the ears also, and etc. Then some general systemic symptoms, because the disease is systemic disease. As we mentioned in the previous slide, it affects or it involves the lungs, kidneys, skin. So it is other systemic manifestations of Wegener's granulomatosis include anemia. Patient is very weak. They are tired because of anemia. Night sweats are also very common. So these are some very common systemic features of Wegener's granulomatosis. Migratory arthralgias. Arthralgias are pain in the joints. So migratory arthralgias, usually the pain is not limited to one joint, but it keeps on migrating from one joint to another. Then there is cough, hemoptysis, which is blood in the sputum. It involves the kidneys, so renal failure can also occur with Wegener's granulomatosis. There is high serum creatinine level because of the involvement of the kidneys, because of the renal failure. So all these are the clinical features of Wegener's granulomatosis. It is a multi-system disease, involve the different systems, and it can be very serious if it involves the kidneys and other structures of the or other organs of the body. These are some pictures that shows the appearance of Wegener's granulomatosis, nasal discharges. There is saddling of the nose, deformity. Kidneys are also affected, and there is high serum creatinine and renal failure. The diagnosis and treatment of Wegener's granulomatosis. Diagnosis is usually done by the nasal biopsy. And biopsy is performed if there is necrosis or death of the tissues, and if there is ulcer formation. Also, if there is epithelioid granulomas, then biopsy can be performed, and if there is vasculitis. ESR, erythrocyte sedimentation rate, is raised in Wegener's granulomatosis, as with any other infectious condition in which the ESR is raised, which is the rate at which the red blood cells or erythrocytes settle at the bottom. This is the histological appearance of Wegener's granulomatosis, and these are the lesions of the Wegener's granulomatosis. Treatment is by the steroids, and with the steroids some cytotoxic drugs are also used, like cyclophosphamide and azathioprine. These are some cytotoxic drugs that are used for Wegener's granulomatosis, and it can itself has very serious side effects when the patient is using these immunocompromised drugs. Next, T-cell lymphoma. These are the pictures that shows the involvement of the nose by T-cell lymphomas and how bad it is, what's the deformities, also called midline malignant lesion or polymorphic reticulosis. So these are the two other names used for T-cell lymphoma. Start on one side of nose, extend to the orbit, so it's on the one side unilateral, and then it spread from there to the orbit. It can be angiocentric. Angio is the term used for blood vessels, angiocentric and angioinvasive. It can invade the blood vessels and cause different complications because of that feature. No involvement of lungs or kidneys in this case, so it's less systemic effect in T-cell lymphoma as compared to Wegener's granulomatosis, in which we have involvement of the lungs and kidneys, and complications can occur as a result of involvement of the kidneys. So it's angiocentric and angioinvasive that can cause a lot of complications associated with T-cell lymphoma. Diagnosis is by immunohistochemical tests are done for the diagnosis of T-cell lymphoma. Treatment is, if it's the lesion is localized, usually radiotherapy is used, but if it's disseminated or widespread, chemotherapy is also used for the treatment of T-cell lymphoma. Oma is for the tumor, so the treatment used for this is like any treatment used for the tumor or malignancy. Finally, sarcoidosis. Sarcoidosis is granulomatous disease of unknown cause which resembles tuberculosis on histology but with the absence of caseation. So on histology, sarcoidosis resembles tuberculosis, but in the absence of caseation, caseation is when there is softness or cheesy material present, that's the caseation. But in this case, that caseation is absent. Systemic disorder like Wegener's granulomatosis, and it also involves lungs, lymph nodes, eyes, or skin. So also like Wegener's granulomatosis, it's a systemic disorder, not like T-cell lymphoma, which is not as systemic. Usually it's more limited. In this, there is involvement of the lungs, lymph nodes, eyes, or skin. Submucosal nodules are present in the nose in case of sarcoidosis. Submucosal means under the mucosa, the nodules are present. And if you see the picture of sarcoidosis, it's not as damaging as the other conditions we saw the pictures. So it's not as destructive as Wegener's granulomatosis or T-cell lymphoma. Diffuse pulmonary infiltrates are present, in this case with hilar adenopathy. So as the condition resembles tuberculosis, in tuberculosis there are also, you can see on the chest x-ray different infiltrations or picture. In this case also there is diffuse pulmonary infiltrates are present, and there is enlargement of hilar lymph node because of the spread of infection to the lymph nodes. Diagnosis and treatment of sarcoidosis is by biopsy of the lesion. Systemic steroids are used for the treatment, and also some nasal sprays are also used for the treatment of sarcoidosis. So that's all about the some unspecified causes of granulomatous disease of the nose, in which we discussed about the Wegener's granulomatosis, T-cell lymphoma, and sarcoidosis. And out of all these three diseases, the most damaging is Wegener's granulomatosis. It's a multi-system disease and can cause renal failure and increased level of creatinine. So thank you for watching sqadia.com.